Lupus is a disease in which your immune system attacks the tissues in your own body. Your immune system is made up of white blood cells that defend your body against foreign invaders. Normally, when foreign invaders, such as viruses and bacteria, get into your body, some of your white blood cells identify them as foreign because they contain substances called antigens. This recognition causes some of your white blood cells to make chemical markers called antibodies. These antibodies attach to the antigens, marking the foreign invaders as targets for your immune system to destroy them.
Lupus, or systemic lupus erythematosus, SLE, is a chronic inflammatory disease that occurs when your body's immune system attacks your own tissues and organs. It is categorized as a multi-system pleomorphic disease in which inflammation, antibody production, and complement-fixing immune complex deposition results in tissue damage. Lupus affects almost every organ system, including the circulatory, integumentary, immune, endocrine, excretory, digestive, nervous, muscular, and skeletal systems in one way or another. While there is no cure for lupus in this day and time, researchers are working hard for one. Most people who have lupus are female. In fact, 90% of SLE patients are. Lupus is brought on when predisposing genetic factors activated by environmental factors, drugs, or infectious agents result in an abnormal immune response. One major organ system lupus affects is the cardiovascular system. Lupus patients are 5 to 6 times more likely to have heart disease than a healthy person. Because lupus causes white blood cells to secrete excess antibodies that attack the body's own cells, tissues get inflamed and cause blood vessels to leak fluids. The effects of inflammation in the heart causes chest pain. The leaking blood vessels may also cause a collection of fluids in the heart called pericardial effusion. Pericardial effusion causes an interference with the normal beating of the heart and shortness of breath. Lupus patients are far more prone to the development of atherosclerosis, or plaque buildup in the arteries, because of low levels of HDL. Atherosclerosis creates a lack of oxygen-rich blood supply to the heart muscle tissue, causing a heart attack. Low levels of hemoglobin and blood platelets are commonly seen in patients. Hemoglobin carries oxygen in red blood cells to tissues, and platelets clot blood after a cut. Low levels of platelets can cause severe bleeding. Another system lupus affects is the skeletal system, mainly the joints. Arthritis is very common and can be found in 90% of all lupus patients. It's most common in the hands and wrists, but can be found in the knees as well. Also, the tendons and ligaments around bones can be weak and unstable, causing deformities and pain.
Lupus, which is an autoimmune disease, affects the digestive system in ways of lower abdominal pain and diarrhea due to arthritis in the large intestine, resulting in ulcerations of the intestines. One major symptom of lupus that affects its patients is dysphagia. Dysphagia is due to arteritis in the esophagus, resulting in painful or difficulty swallowing. Arteritis is an inflammation of the lining of arteries. Another symptom that affects patients is gastroesophageal reflux, which is a condition in which food and liquid travels backwards from the stomach into the esophagus. In other words, throwing up. Also, excessive fluid buildup in the peroneal cavity has been linked to lupus patients. Excessive fluid buildup is caused by nephritis. Nephritis is chronic inflammation of the kidney affecting the structure of the glomerulus, which leads to infections. The production of hepcidin, a dominant regulator of iron absorption in the duodenum, is increased in the liver of lupus patients. Hepcidin inhibits iron absorption in the duodenum and blocks iron release from macrophages. This leads to the presence of an iron deficiency due to hepcidin overproduction. Lastly, to a lesser degree, lupus affects the muscular system, causing swollenness and soreness to joints and muscles.
In a normally healthy person who is not suffering from lupus, the immune system protects the body from foreign invaders. White blood cells, or B and T cells, play a very important key role in the immune system by flagging and fighting infections. Antigens elicit the response of these cells by binding to the substance and producing cytokines, which cause B cells to multiply, turn into plasma cells, and ultimately secrete antibodies. Generally, remnants of these complexes are removed by the spleen's garbage disposal system. However, in patients with lupus, this is not the case. The immune system is greatly affected by lupus. The cells of the immune system actually start to injure the body's own tissues and begin to attack self. Regulatory T cells are deficient in SLE patients as well. B cells and T cells are also overactive, causing an increase in the production of autoantibodies, which are antibodies that recognize and destroy the body's own cells. Autoantibodies are linked to heart attack, stroke, pregnancy complications, and blood clots. This causes pain and discomfort within patients who have lupus. However, the main concern is irreversible internal scarring. Medication can be prescribed to curb the inflammation process, which causes a greater ratio of pro-inflammatory to anti-inflammatory cytokines, which cause an unbalanced regulatory mechanism. This overproduction of these molecules leads to the immune system to be overactive, which causes an inflammation and injury to tissue. Within patients who have lupus, there are deficiencies of certain complement proteins as well. Lupus can be compared to friendly fire because it ultimately jeopardizes the function of certain organs and systems in the body by permanent scarring.
The integumentary system consists of the skin, hair, and nails. In a healthy person, it acts as a physical barrier to protect the inner organs and structures of the body. With lupus, the immune system attacks itself and it comes out in the integument through inflammation. A very common symptom of lupus is the butterfly rash, which develops on the cheeks and the bridge of the nose. Unlike other rashes affiliated with lupus, this leaves no scarring. One type of lupus, which comes out only through skin rashes, however, does leave scars due to pigment loss in the skin and also thin hair on the head and body. UV exposure causes rashes that are very painful and intensified and can also cause lupus flare-ups in other parts of the body. UV exposure causes rashes that are very painful in the majority of lupus patients. Another way lupus affects the skin is vasculitis, which affects the blood vessels in the skin, mainly on the legs and arms, causing red, painful blemishes. Lupus affects the respiratory system slightly, but not as much as it affects other organ systems in the body. People with lupus often experience pain when breathing deeply, coughing, and shortness of breath. In more serious cases, fluid can build up in the lungs and constrict them. However, the steroids used to treat them will work quickly as well as pain reducers. Lupus patients are at a higher risk of chest infections because treatments weaken the immune system. Some lupus patients are also more at risk for blood clots leading to further health problems. There are a number of treatments for lupus, the most common ones being topical ointments or steroids for direct application on the skin. Others include oral steroids or other pills. However, they have many side effects and are only used with more severe cases.